I'm Dan Suffoletto from Public Health, Dayton and Montgomery County. We want to welcome you here to our live virtual news conference that we're presenting here on Facebook for you today. We're trying to keep it safe here in Montgomery County, so we're doing it virtually. We appreciate all of our guests today. We appreciate the members of the media joining us as well. What we're going to do is have some brief presentations, and then we're going to open it up for questions from the media at the end. Today we have with us Jeff Cooper, Health Commissioner of Montgomery County. We have Commissioner Judy Dodge from Montgomery County. We have Shannon Cox from the Montgomery County Educational Service Center. We have Lisa Henderson from the Greater Dayton Area Hospital Association. And we have Father Ben Spear Hardy from St. Margaret's Episcopal Church. Dr. Michael Doan, he's the medical director here at Public Health Dayton and Montgomery County. And then joining us a little bit later will be Mayor Nan Whaley from the city of Dayton. So with that being said, we thank you for joining us. And I want to turn it over now to Health Commissioner Jeff Cooper. Jeff?
Thank you, Dan, and thank you for our community partners, including the media, to participate in this virtual news briefing update. We're all familiar with what's happening across this state and country with respect to the spread of this virus. And as everyone's aware, last week we had the governor's stay at home tonight order go in effect from November 19th through December 9th. And then the Montgomery County Board of Health last week issued a stay-at-home health advisory for Montgomery County citizens from November 19th through December 17th. And there's those two, both the order and the advisory, those two documents are complementary, and they are clearly needed for this community. When we look at the spread of this virus, as we have been saying, we continue to see this rapid spread. I'm going to share my screen here for a moment because I think it's really important to have a visual for everyone. Everyone see that?
Yes, we see it.
Okay. So as we have been saying, we are seeing an increase in cases throughout our county. And as we have shared for the past multiple weeks, we saw initially an increase in mid-July, then we had a significant outbreak and a spike in cases near the end of August. And clearly, since the beginning of October, our 7-day moving average continues to increase significantly. We are now averaging 7-day moving average 366 new cases per day being reported to this health department. And our highest number of cases per day reported was on November 16th, over 550 cases. So clearly, it's a visual. We can all understand what's happening with the spread of this virus. Everyone watching this can interpret what this line means. We are seeing rapid spread throughout all communities in Montgomery County. So that's the purpose of this news conference. We need to be able to communicate to our citizens the actions that they need to take to protect themselves and their loved ones. We are on pace for the month of November. Through today, we have over 6,700 cases, new cases reported in the month of November so far. So if we're going to average 350 to 360 cases per day, by the end of this month, I think we can all understand the total number of cases that we're going to see in November. And if we don't change our behaviors, then that's just going to continue to elevate throughout the month of December. Another important reason for having this briefing today is that we know from past data that we are seeing increases in cases 2 weeks after a holiday. So we saw an increase in cases after Memorial Day holiday, an increase in cases after the 4th of July. We had a huge increase in cases after the Halloween time period. And now we're heading in to Thanksgiving. And the reality is, if we don't change our behaviors and we continue to gather like we traditionally do, we will see a significant increases in cases within Montgomery County following the Thanksgiving holiday. And that significant increase in cases places a tremendous burden on our healthcare system, specifically our hospitals. And we have Lisa Henderson here today from the Greater Dayton Area Hospital Association to kind of put into perspective what this pandemic is doing to our hospitals and what they're seeing now and how it's creating a strain on their resources. And some pretty difficult decisions are going to need to be made if this trend continues. So the message is very clear. Public health recommends that we do not host or attend Thanksgiving gatherings. And I know that's a difficult message to give because it's a time-honored tradition for all of us. But we really should only be having dinner or the meal with people who live within our household. And we've said this for multiple weeks now. If we're going to gather, and some people are going to ignore the knowledge and they're simply going to gather, then we have to take precautions when we gather. Wear a mask at all times, limit the number of people in attendance, etc. But the public health recommendation is that we do not host or attend Thanksgiving gatherings. It's okay to prepare food and deliver it to someone, but we really need to be limiting our social interactions if we indeed want to reverse that upward trend in cases that we are seeing. And to make this a little more real, maybe we need to put this virus spread within the context of what it's doing in terms of the death of our residents. So public health traditionally tracks leading causes of death throughout Montgomery County. We put it in every one of our community health assessment documents, and the 2019 version of that document is on our website. It's available to everyone. It's the Community Health Assessment 2019. When you look at leading causes of death for our county, and this is it's probably pretty accurate for other counties throughout Ohio, the top 10 leading causes of death are always heart disease, cancers of all type, accidents of all type, stroke, chronic lower respiratory diseases such as emphysema and COPD, and then Alzheimer's disease, diabetes, kidney disease, and then influenza/pneumonia. Well, now we have data to indicate that at present for 2020, preliminary data, but COVID-19 deaths are about the 6th leading cause of death of Montgomery County residents. And that's just going to continue if we don't alter our behavior. So this is a very real pandemic. It is causing morbidity and mortality among our residents, and we have to take actions collectively as a society to protect each other. So there's a lot of data, there's a lot of work going on with respect to all community partners. We're in this together, and we have to make the really difficult choices to protect each other, because otherwise our numbers are going to increase. We're going to come back next week and show you a new graph, or 2 weeks or a month from now and show you a new graph, and that line's just going to continue upward, and it's going to continue to place a major burden on our healthcare systems to the point where it's going to compromise care for those who need it most. So with that being said, that's a quick update in terms of the seriousness of where we stand as a community with respect to this virus. And I will turn it over for some comments from Commissioner Judy Dodge.
Thank you.
Jeff, can you unshare your screen?
Yep, I will do that.
Okay. Well, first of all, I want to thank Jeff Cooper and the entire public health staff for not only supporting the governor's stay-at-home order, but enhancing it. You know, as difficult as it is this time of year to stay away from family and friends, and we all know that, we owe it to them to do that, because any of us could be a carrier and not even know it. You know, I think Jeff just gave us some very sobering statistics. And, you know, as great as our hospitals are in the Miami Valley, they're not going to be able to handle these kinds of numbers for too long, no question about it. But you know, what you're seeing here today is a united front, different government agencies working together to fight this virus, because frankly, losing this battle is not even an option. Now, here in Montgomery County specifically, we made our COVID-19 protocols fairly strict from the start because we didn't know what kind of devastation it would bring. We quickly set forth social distancing measures, and risk management and safety worked side by side with our facilities teams to have plenty of hand sanitation stations, additional cleaning services, and things like safety barriers for our employees who must engage with the public. Now, what's different now than what we had set up in the spring is that we now have pulled out our self-scan room in JFS. That's our kiosk. Because while it provides great convenience for customers, it is not a necessity, so the risk seemed greater than the reward. But largely, it is business as usual, and we are keeping the same safety protocols in place that we started back in the spring. Because at the end of the day, the people of Montgomery County need us now more than ever, and we are here to serve them. Besides the county's water, sewer, and trash services, we also offer food, childcare, and Medicaid assistance, in addition to caring for our most vulnerable citizens at Stillwater Center and Children's Services. And we need to continue offering our business services so we can help people get trained and get ready for employment. Those needs don't go away, ever, even during a pandemic. So we are still here for you, offering services in a safe and professional manner. I just want to wish everybody a safe and happy Thanksgiving. Please, everybody, use your Zoom or FaceTime app to get ready to go to see your family. So we're all going to get through this together, no question about it. So please, again, have a wonderful Thanksgiving. And now I want to invite Shannon Cox, who's the Superintendent of Educational Services Center. Thank you.
Thanks, Judy, and thank you to Public Health for bringing us all together today. So as we move through the year, we've fluctuated school year calendars. We have had restart and reopening plans that have been revised probably 1,000 times throughout the county. So we knew from the onset of this pandemic that remote learning was going to be vital to our students. And we also knew that we were going to have to move in and out of remote learning in as much of a fluid way as possible. But what we also knew we were going to have to do as school officials is really attempt to minimize the impact on families and the level of disruption of education. And so we know that the decisions that have been made through each of the school districts in Montgomery County have been very hard decisions to make, and they have taken in every piece of data that they have been afforded to make those decisions. So the number one thing that we continue to come against in public school is our staffing. We know that, and much to everyone's surprise, we know that schools are actually not the super spreaders that they were once projected to be. We have had the CDC come out and say this past week that actually they're safe havens. They're spots that are really protected because the protocols are really strict, and the people that are on the inside of the walls are doing all the right things. But we just know with all of the community uptick in cases, with community spread, we're going to have an uptick in numbers. And due to the quarantining protocols that exist and the criterias, we are all being faced with tremendous staffing shortages for our aides, our transportation drivers, our cafeteria workers, and our school teachers, the entire gamut. So once again, we find ourselves coming to this holiday time in our calendar. And while that is normally a time to celebrate, the calendar is really not in our favor when it comes to all of the data that Jeff just shared, as it then will play out on the inside of the school walls. So we're already facing staffing challenges, and now we're going to go home and we're going to see an uptick typically of those cases. And again, what we see on the inside of the school is nothing more than just a mirror of what we see, what's happening in our communities. So I'd like to really just draw attention to all of the school calendars. We have 16 public school districts. We have a variety of charter schools. All of those school officials are making plans, and please don't expect them all to look like one another. Each of the school administrators are taking into account what's happening in their communities, in their school districts, and making sort of return to school take 3 plans as we embrace the holidays. So you're going to see calendars that have been completely redone, as we have most recently seen here at our ESC and Dayton Public, where we are literally pressing pause on education and taking those days and putting them to the end of the school year in June and extending the school year all the way to a remaining of in-person learning at Brookville. So, and we've got everything in between, hybrid and blended learning, some 2 days on, 2 days off. It just really depends. So please, please, please check your school calendar, check your school website, stay in communication with your school officials. So just a couple of things to kind of keep into consideration. While you have this time off, it is going to be very important that we make certain that we do the best that we can on the outside of the school walls if you do expect to return to the inside of the school walls. Staffing and students alike, you guys, we've had a great first quarter up until about mid-October. We had great numbers, great success, but it's because we really took to heart what was happening on the outside of the school hours. We know we can do this successfully. We've done it before. We've continued to do it in many of the school districts. We just really look forward to returning those students' faces inside. The best place they can be is at school with us all, and we can't wait for that to happen. But in the meantime, mask up, back up, wash up. And at this time, I will turn it over to Lisa Henderson at the Greater Dayton Hospital Association.
Thank you, Shannon, and thank you again to Public Health for bringing us together. As Jeff said, we have a lot of information and data that we can share, but some very clear messages. So we know making decisions going into the holiday has been challenging and likely confusing for many. However, the absolutely unprecedented increase in the hospitalizations in our region, as well as the use of ICU and ventilators, should offer a clear understanding that we're alarmed. So we're setting new records, as Jeff said, almost daily in these numbers. Our COVID hospitalizations have doubled in just 3 weeks, and we're prepared for that to continue. As our numbers climb, our hospitals are working to continue to manage the impact so it can be absorbed safely, and this strain on people and resources is constantly being monitored. Our biggest capacity constraint, as Shannon said, really, is not in physical space, but it's in staffing availability. So we are excited about the possibilities that the vaccine offers, but it's not here yet. If this trend continues, we could be facing the same challenges as many other regions, but we can still prevent that from being our story. Just change is needed now. Our healthcare workers are heroes. They continue to work in the most demanding circumstances, still providing high quality care for each and every patient. But the community spread is impacting each of these staff members. And as the governor shared yesterday in his address, we have not seen a plateau in this data. Our hospital leaders are working together to plan for what comes next on behalf of our 29 member entities across 11 counties, ensuring that we can care for the people of our region, whether that's for COVID-19 or other medical conditions. But we hope to not have to use those plans. So again, we look forward to what the vaccine offers, but ask for your patience since it's not yet available. Please wait to contact your physician office about getting the vaccine and know that we're making plans to distribute it as it becomes available. What we do now and this week has a direct impact on our hospitals and all of their staff. We know that many are tired of hearing about COVID-19 and have dealt with so many of the effects from this pandemic. We know that these are challenging times because we want to be with our friends and family, but we're asking all of you to take the measures we know impact this spread. Do it for yourself and for your friends and family and for our hospital community. I will turn it over now to Father Ben Spear-Hardy of St. Margaret's Episcopal Church. Father Ben?
Thank you, Lisa, and thank you, Public Health, for having this media briefing today. Give thanks to God for all of you and for your hard work. I'm an extrovert as a priest, and I love to be around people. I get energized by being around people. But since COVID, I had to change. So much have changed in my life and in the life of my congregation. I get a lot of questions on Sundays of when we're going to get back in church. I say when But Jeff Cooper says, okay, then we'll go back. So I tried to listen to the health advice from public health, from the CDC, and to encourage people to be patient. It takes a lot of patience as we go forward. I understand that we love being around family members, and this is the holiday season, Thanksgiving, we want to gather. Last year we had a house full of people. It's not going to happen this year. Only 2 will be in this house. We understand that if we gather, it's going to be a super spreader. And if we love our family members and friends, we will do the very best we can to make sure that they are protected by keeping our distance, by wearing masks, and by washing our hands. There will be another Thanksgiving. This is not the last, but we have to exercise every precaution that has been given to us by public health to do what we can to make sure that we are safe. Don't be anxious. If you have to, and can you believe since March, I've been doing service virtual, and people miss being in church, but everything is done virtual. All meetings are done virtual. Everything is virtual. We have to adapt and cope with what's happening right now. And this too shall pass, but it takes patience. And I'm just begging and pleading with churches to continue to worship virtually, and the members and family members who want to see their loved ones, so please, please be patient. The time will come when we'll all be able to get back together again, but this is not the time, because COVID has been devastating for our community and for the entire nation and the world. But it's incumbent upon us to do our part to be responsible during this holiday season. Be patient, my brothers and sisters. Be patient. Wear your mask, keep your distance. Please do not gather in large numbers and all of that. Just those in the household celebrate Thanksgiving together. The time will come when all the family members will get back together. But this is not the time. Please, please, please adhere to the signs. Listen to public health. Listen to CDC. Keep your distance this Thanksgiving season, this holiday season. Please, if we love our loved ones, we will do the very best we can to make sure that they are alive for us to enjoy our times together. Thank you.
And next we have our medical, thank you, Father Ben. Next we have our medical director, Dr. Michael Doan. Dr. Doan.
Thanks, Dan, and thank you for your comments, Father Ben. I'm going to touch on a few topics that other people have sort of mentioned already. I think the kind of piece that's been in the news is that the first vaccine that announced some results, the Pfizer vaccine, is now applied and put in all the paperwork for their emergency use authorization. The emergency use authorization is being reviewed right now by the Food and Drug Administration with an independent advisory committee. The vaccines as they come out, as was alluded to by Lisa, there are people out there who are anxious to get the vaccine, are enthusiastic about it, and are trying to figure out how to do that. It's really too early to know for the general population. Likewise, I realize there are people that are skeptical at this point, and I think they have some valid concerns and that we will be getting more information. So that as the Food and Drug Administration does the advisory committees, they will get all of that information. Those committees tend to be, if I might say so, a little skeptical themselves. So that they're looking at that data, they're saying, is this really what you're presenting it as? Is there something here that we as a committee want to know that hasn't been presented? They may ask for different analyses, they can ask for additional information, so that those committees are pretty thorough. And the emergency use authorization, the FDA is using the same criteria as for a regular approval, but they're doing it under the emergency use because that's a somewhat faster administrative and bureaucratic process. I think the vaccine's first going to roll out to healthcare personnel. These are people that have been literally putting themselves and their health and the health of their families on the line for months now. And we know from the fact that healthcare personnel have been overrepresented in terms of cases that they have suffered from the sacrifice that they've made. And it's important to keep them well. Lisa talked about the hospital situation. You can think of it in terms of there's staff And then there's a certain amount of space that the hospitals have to use. And then there's stuff like ventilators or other things, PPE, personal protective equipment, et cetera. At this point, the crunch is really on staff because they are beginning to get sick. And so the space is there at this point. They've got the stuff and it's the staff. And so those are people that need to be protected. And those are the people for whom the vaccine will be given first. So I think that the vaccine's sort of coming along. The newest one from AstraZeneca looks like it also has excellent response rates. We're still talking in the 90-95% response rate and effectiveness, which is good news. There haven't been any major complications reported. I think all the vaccines will, like any vaccine, give you little minor things. You may be a little achy. Certainly any vaccine or any shot for that matter can give, end up with an arm that feels a little sore for a day or so. But a number of people have gotten these vaccines, and the trials in the United States actually enrolled about twice as many people as they needed just to test the vaccine. And the reason they did that is they wanted to give it to a number of people under controlled conditions so they could see what the safety profile looked like. And so there have been, of course, minor vaccine-related problems in terms of a sore arm or anything that we might expect with a vaccine like that, but they're not seeing any major problems. And again, as the independent advisory committees look at this for the FDA, they'll be able to give us a better idea exactly how that's working out. So I think that's where we're at as far as vaccines at this point. And I think I'll turn it back to Dan to see if the mayor has joined us yet or not.
Thank you, Dr. Doan. Some great information there. Unfortunately, Mayor Whaley is running a little bit late. She had a previous commitment, but at this point, we want to turn it over to the media. If any of the members of the media have any questions, now would be the time.
And Dan, before we do that, I just would like to say thank you to Commissioner Dodge, Shannon, Lisa, Father Ben, Dr. Doan. We do stand here, well, we sit here today as a system of partners, and we're all in this together, and we're working collaboratively to do what's in the best interests of the citizens we serve. And so I know there's a lot of questions that are beginning to surface around vaccination, but it's important for our community to understand that this is the role of public health to make sure that we can implement the preventive measures to limit the spread of this virus. And we know how to do vaccination planning. We've been doing it for decades. And together with our hospital systems and our schools and other community partners, we will make sure that the resources are in place to distribute this vaccine once it's available. So our community should have confidence in public health's ability to lead our system of partners in the vaccination planning process. All right, so that we'll turn it over to questions.
Anybody?
The question, I think, for Lisa at G'daha, and it's kind of about the stuff we were talking about. We wanted to know, there was a doctor at Dr. Doan's briefing yesterday that mentioned that where they were having possible ventilator shortages. Wanted to see what the hospitals here in our area, in the Montgomery County and regions, are seeing. Are you experiencing shortages in ventilators? How are you doing on that area?
Lisa, you're muted. Lisa, are you with us? She might be. Seems like she might be frozen. Maybe we could try another question and try to get back to Lisa. Sorry about that.
All right. How about I try one with Jeff then? Jeff, I know you're asking people to only have Thanksgiving with just those that live in their home. If they have to, maybe fix food and transport it to someone else, but not to get together. How optimistic are you that that will actually happen?
I have some reserved optimism. I think if we all take a step back, look in the mirror, and be honest with ourselves, it's ultimately about protecting others. And so as we define what we value in life and who we hold dear, I have confidence that our community will make the right decisions and will do what's necessary to protect their loved ones.
I have a question for Jeff too. So right now we're not at a purple level with the state, but you guys have already issued a stay-at-home advisory. If we did hit a purple level, what would be your next move?
So I don't know that there are any additional orders or restrictions. We'll have to look at that. We'd like to be consistent with what other communities in the state do around purple, but it's really about just making sure that we reaffirm the messages around what we need to do to limit the spread of this virus. Obviously, we understand that a vibrant economy is one of the ways we become healthier as a community. So ultimately, public health doesn't want to see restrictions placed on businesses either. And that's why it's important for us as individuals to limit the spread of this virus throughout our community. We know how this is spreading. It's community spread, it's individuals in social gatherings and family gatherings that's spreading this virus. So we certainly would do any type of additional restrictions. We would consult with the Ohio Department of Health and other health departments around the state to be consistent in anything that we would implement. We're not at that point though, and it's important to recognize that over the next several weeks, if we all do our part, we won't get to that point.
Thanks, Jeff. Looks like we have Lisa back with us again. Thank you for reconnecting, Lisa. Mike, do you want to try that question again?
Hey, Lisa, wanted to check in with you about some of the stuff. We talked about space, stuff, and staffing, but there was a doctor with Dr. Doan yesterday that mentioned where he was working. They were having some concerns about ventilator availability. I wanted to see what the case is in our area, in Montgomery County and surrounding counties. Are we short on ventilators? Do we have enough? Are the same number of patients in terms of percentages going on ventilators as earlier in the disease, or have we come to some better understanding to try and keep patients off ventilators?
Thank you for that question. I apologize for connectivity issues. I wasn't dodging the question. We are absolutely tracking and monitoring all of our resources, and that includes the stuff, as you put it. And that's a part of our surge planning, but we are not currently experiencing the same issues as was discussed on the governor's address yesterday. But those are all pieces of things that the hospitals are actively and collectively through GDAHA monitoring.
Thank you.
Any other questions?
I had a question, Caitlin with the Dayton Daily News. I was wondering if people are advised not to meet up for restaurant meals, does that mean, or for Thanksgiving meals, does that mean people are also advised not to meet up for restaurant meals anymore?
So I'll start, and others, Dr. Doan, others jump in here. The stay-at-home advisory, I think we need to revisit the purpose of the stay-at-home advisory, and that is the virus is spreading rapidly, and we should be staying at home unless it is absolutely necessary to leave. So that's school, that's work, it's medical care, groceries, pharmacies. We certainly don't want to create any unnecessary burden on our business community, but the guidance is, unless absolutely necessary, we should be staying at home. And you know immediately when you frequent a business whether they are complying with the Ohio Department of Health and the governor's orders or they are not. If you are going to not stay at home, and we advise against that, but obviously some individuals will not stay at home. If you go to a business and there is no masking and there are not social distancing, then we strongly advise that you not frequent that business.
Anybody else? No. Okay, seeing no further questions. Jeff, did you have any closing remarks?
Other than, we're all kind of saying variations on the same theme. So you hear it from public health, you hear the message from our hospital systems, you hear the message from our educational systems, you hear the message from our faith community. We're all saying the same thing. We need to take care of each other. We know what to do. We know what it takes to limit the spread of this virus. And these are simple precautions that we're all capable of implementing. And it seems simple, but it really does work. So social distance, wear a mask, wash your hands, clean environmental surfaces. Time spent outdoors is really good. And now, additionally, the stay safe or stay at home tonight order and the Board of Health stay at home health advisory. If we adhere to those recommendations, we will limit the spread of the virus within our community. And it's ultimately about our will as a community and our commitment to each other to do so.
Okay, very good. Thank you, Jeff. And thank you to our wonderful panel here today. We had some great information. We want to remind everybody to keep following us on Facebook. We're going to bring more of this type of programming to you. But until then, have a happy, safe Thanksgiving, and we'll see you next time.